This is Core Conversations with Natalie Baggio.
Welcome to a new episode of Core Conversations. I'm Corewell Health team member Sarah Kavanaugh, and we're flipping the mic today. And my guest is president of Corewell Health in Southwest Michigan, Natalie Baggio. Welcome.
Thank you. It feels a little odd to be on the sofa and not in the chair, but I'm glad to be here.
Well, this is going to be a fun one because we have been listening to the community, perusing social media a little, and kind of hearing what people's concerns are, what they're thinking about. And so thank you for allowing me the opportunity to bring some of these points to you today so that we can kind of talk about the facts and what's really going on, what's coming up for Corewell Health, and address some of the things folks are saying. Are you game?
I am, and I think it's really important. You know, one of my values is being transparent and solid communication back to the community, and I think this is a great opportunity for us to be able to address some of the questions that we're hearing.
I agree.
Yeah.
Thank you. Okay, well, let's get into it.
Okay.
So one of the things folks are saying on social media in some ways is that our doctors are becoming scarce since Corewell Health took over. Do you want to address that community perception or misconception, if you will?
Yeah. I think we've had a lot of our physicians that have been in the community for many years retire recently. We've had some physicians that have moved to the community and just didn't feel connected to Southwest Michigan. But when we start looking at our recruitment efforts, replacing some of our physicians, in 2024, we had one of our best years, and 2025 was right behind it, of bringing new physicians here, growing new talent, and being able to secure healthcare here locally.
Amazing. Okay, so doctors aren't leaving. Doctors aren't leaving.
No, that is, I mean, we've had some doctors leave,
Yeah,
but it's
of
not,
course,
our
life
turnover
happens.
rates are not higher than they have been over the last 10 or 15 years.
Okay, great. Thank you for that. So another thing people say kind of in that same vein is, I can't get in for appointments. Ever since they became Corewell Health, I can't get to my own doctor. Could you address some of those concerns?
Yeah. So we do not have enough doctors here in Southwest Michigan. We are not able to serve the community the way we'd want to. And that's just not Corewell Health. I mean, when I look at the population, the people who need access to care, I'm looking at all of our healthcare partners across Southwest Michigan. And we do need to bring more physicians here. And we're on a pathway to recruit over 60 more doctors. Some of the challenges are because we don't have enough doctors across Southwest Michigan. The other challenge is the way people access healthcare today is something from the past where I know a physician, I know a practice, I'm going to call that one number. And if that practice does not have openings or openings for 6+ months, you have to look at about 15 other medical practices or more to call each one of those numbers and ask the exact same questions. So one of the things that I'm proud of the work that we're doing to modernize our services is a one-call number. And we're in the process of doing that. I don't have a release date yet because it does take time, but our goal is to get to where you call one number, someone on that end says, where are you from? How do I help you navigate? And this is the nearest appointment closest to you. And then our community can be able to pick and choose where they want to have their care and how quickly they can get it.
That's amazing. Sounds a lot better than calling 16 places
Yeah.
and saying the same thing. So
Or more, but yeah.
That is great news that is coming. Pivoting a little to the topic of OB and labor and delivery services here in Southwest Michigan, the perception is that the services are dated, that they're poor services, poor quality services. Can you speak to that concept a little?
To address like OB specifically, we're behind the times in our infrastructure and our facilities.
Okay.
And just a couple of years ago, we started a campaign on how to modernize our facilities. And we've done really well. So this year, we are starting our renovation in St. Joe at the hospital and investing over $10 million
Wow.
to modernize the experience, modernize the facilities. And I'm really excited to be able to show the community the new renderings and what we're doing to make the rooms and the space feel fresh, convenient for families, and to be able to have that bonding experience post-delivery.
That's awesome. Will there be comfy chairs for the dads if they have to stay the night?
Comfy chairs, fold-out beds, beautiful stations and head walls. I mean, it's going to be great.
Cool. Can't wait to see it. And then also some thoughts on why don't we have a NICU here, or what do we do when a baby, or even pediatrics, when you need that elevated care? What would you say is happening there as far as
so
that?
we are exploring a relationship with Helen DeVos Children's.
Okay.
And working with their physicians that rotate through the pediatric department and oversee the nursery specifically. And what that's going to allow us is to elevate the care that we can provide in our nursery to a level 2 nursery. And that'll end up keeping more moms and babies local. And that's what we want. We don't want to transfer our moms and babies out of Southwest Michigan.
Right.
We want to keep them as close to home as possible. And this relationship will allow us to do that.
The theme I'm hearing is good things are coming and it's getting better and better.
Yeah, and this is part of the advantage of being of a larger health system, is where we can think about how to leverage expertise that may only be located in more metropolitan areas. But having this level of relationship allows us to bring care to a more rural area and elevate the care to keep care more local. And I love that about Corewell Health, is that they're willing to invest and support that infrastructure to keep care local in smaller communities.
And I think that is what community folks need to hear, because oftentimes it's real easy to say, oh, this big healthcare system came in and bought out Lakeland hospitals. But what you just shared is exactly what the good part of this is. You know, you are showing the positives that actually they're helping, investing in making care more available and higher quality here in Southwest Michigan. So I hope people hear that.
Yeah, and we've gone through some changes. And I think
Yes.
the community has felt some of those pain points with modernization and optimization of technology. But what I'm hearing when I'm out and speaking to people in the community is that it's getting better because they're learning the new systems. They're learning how this care is more integrated and can be more seamless. And that's been the goal. The foundation of how we continue to provide care more locally is that things on the back end have to be connected, and then people on the front end have to be able to reach it more easily.
Perfect. Thank you for explaining that for people like me that don't always understand the ins and outs. Last question I have for you is in relation to radiology. And we heard some people saying that they have to wait a really long time to get their images back. Do you have any thoughts, or have you heard that before?
Over the last several years, it has been challenging. There's a shortage of radiologists nationally, which has impacted the entire state of Michigan as well. We have some really good processes in place today that those wait times are less than they were a couple of years ago. So we're proud of that work that we've been able to accomplish, but we're still not where we want to be today.
Okay. Listen, I so appreciate your honesty today and your transparency. And this was a really nice way to flip the mic a little. So thank you for being willing, Natalie.
It's my pleasure.
Thank you for watching this episode, and we'll see you next week. I want to say good morning, but I won't. But I want to.
Yeah.
I know, no time.
No time. With me today is President of Corewell Health in Southwest Michigan, Natalie Baggio, on the other side of the couch. I wanted to say good morning, Ryan.
This is okay.
And
okay.
President of Corewell Health in Southwest Michigan, Natalie Baggio.
Good morning. Oh.
I know it's hard not to say it.